They injected stem cells directly into the damaged spinal discs, and the discs regenerated. Not completely, but still significantly. This is different than just masking the pain with a cortisone shot, and the MRI supported it. I'm Dr. Rubin, and I review the studies so that you don't have to. Today I'm breaking down a study from the journal Transplantation. It's 24 patients with degenerative disc disease. We're talking chronic back pain that's not responding to physical therapy, medication, or epidural injections. Here's what you need to understand about degenerative discs. Your spinal discs are like jelly donuts between your vertebrae. They cushion and absorb the shock. But when they degenerate, they lose water content, they shrink, and they become painful. Traditional medicine says once they're gone, they're gone. Pain pills, injections for temporary relief, or eventually fusion surgery may be the end result. But what if we could actually repair the disc? That's what these researchers were asking in this particular study. Here's what they did in the study. They took mesenchymal stem cells from bone marrow. These aren't embryonic stem cells. This is adult stem cell therapy. However, these cells still have the ability to transform into cartilage, bone, and other tissue. Using precise X-ray guidance, they injected 25 million of these cells directly into the damaged disc. One injection, 5 minutes, that's it. Then they tracked these patients for an entire year, measuring 3 things: pain levels using the visual analog scale, daily functioning using Oswestry Disability Index, that basically assesses how well you function, and MRI scans to see if anything structurally changed. The results: at 3 months, patients started reporting less pain. At 6 months, more significant improvement in pain score continued, and functional scores started to improve. Patients were doing activities they couldn't do before. But here's the take home. At 12 months, the MRI scans showed the discs had actually improved. We're talking increased disc height and increased water content. The discs were rehydrating. They were regenerating structure. This wasn't just pain relief, this was actual tissue repair visible on imaging. Think about what this means. For decades, we've treated degenerative disc as a one-way street. Once your disc degenerates, we manage the symptoms until it gets bad enough for surgery. But this study suggests we might be able to reverse the process. We might be able to restore function at the cellular level. Reality check. This was 24 patients. That's a small study. We need larger trials to confirm these results. Also, these were carefully selected patients. Single or double disc degeneration who hadn't had prior surgery. Not everyone with back pain is a candidate. And here's the really important part. These patients had failed conservative treatment, so this wasn't a first-line therapy. They had tried other options first. This information is for educational purposes only and does not constitute medical advice. I'm sharing this research to help you understand what's been studied in regenerative medicine, not to recommend any specific treatment. Results in research studies don't guarantee individual outcomes. What worked for these specific patients may or may not work for you. If you're dealing with chronic back pain that hasn't responded to traditional treatments, talk to a qualified spine specialist about all your options, including whether or not you might be a candidate for regenerative therapy. Comment below if you want me to break down more spine studies like this one. Happy to do it. Please like, follow, and subscribe.